Right.
Perfect. All right, go ahead and shift the camera so it's up.
There you go.
Well, actually, David, you were going in the right direction. If you could just get off screen so the only person we see is Beth, much better. Well, okay, David, you can come back on screen again.
So,
yes, exactly. Well, welcome back. You all have the unique and distinct honor of having probably some of the best feedback from folks who watch your episodes. One included, of course, is Pat Hotelling, my mother-in-law, who had her birthday this week.
Happy birthday, Pat.
Absolutely. So it's great to have you all here for this discussion. For those who haven't tuned in yet to these, what I'm now calling Catalyst Talks, named in part by our book Catalyst that we wrote a couple of years ago, Brett Boyd and I. You know, people like David and Beth come on this show. They're subject matter experts. They're thought leaders. They're people that are actually there doing the hard work of whatever subject it is we're talking about. The whole genesis for this was, in the Army, I talked to the platoon sergeants and the first sergeants who helped me understand how to be a better Army officer. And then in business, I talked to the other entrepreneurs about how to be better as an entrepreneur, what the hell I was doing. And now in this era of COVID, nobody really knows what's going on, but we're doing the best to take advice from experts, combine it with data, and make sound decisions. And so this has become a regular discussion with you all. So welcome back.
Thank you.
Thank you.
I put your biography down below. Bottom line, you all have been in medicine and serving as pediatricians for nearly 2 decades. You've been there, done that. You not only run a company together, you run a family together. So you are literally at all 3 tiers of those frontline folks that are right there on the edge of this, helping out with the sick. Of course, there are those people that have been laid off or furloughed that have lost their jobs. And then that 3rd tier are those small businesses like yours trying to stitch it together. So 3 topics today. You jump into whichever one you want. One is this notion of how data is being used and abused in different places around the country about making decisions. Secondly, is about what's really going on in terms of the virality of this, the lethality of it. And then thirdly, crisis communications. Who's doing well, who's not doing well, how we make sure people understand what they need to know. So with that, Saturday afternoon, y'all take it whatever direction you want on this latest Catalyst Talk.
Oh, yeah. It's just a free-for-all.
There you go.
It is. And then we're going to take questions from folks if they come in live here, and we'll point it in whatever direction they want to go.
I think the big thing that happened this week is the study from the Gilead that came out of Chicago. And, I think that initially you saw the stock market react to it, that they treated 103 severe patients with COVID with their drug, and only 2 of them died.
Now, is this the HIV-related drug?
Remdesivir.
Yes, it's antiretroviral, is my understanding.
Right, and it's in that same class as the anti-HIV drugs, but this is the one that was developed for Ebola and is one of the ones that did not work. But Ebola also being a virus, they've tried it for this, and it seems like there's some effect.
So I think when you talk about how's data being used and abused, the issue that you get into is if you look at that, you have 103 or 113, I think was the actual number, and 113 people with severe disease, only 2 die. That sounds great, right? Because your natural instinct would be that 80% of people that are in, or 70 to 80% of people in ICUs, presumably if you have severe disease, you're in an ICU, and 70 to 80% of those people are dying, and now we went to less than 2%.
Right.
But when you get into the actual data or the actual study that was actually published, they define severe disease as they exclude anyone with multi-system organ failure, heart failure, pulmonary failure, renal failure, liver failure. So you're really not dealing with critical people who are the ones in ICUs. You're dealing with people that were admitted to the hospital. And so it can be misleading. Now, I personally think it's logical that it may work for this, but I think the thing is we really need, and this is really frustrating, I think, because, it's one of those things. I think a great example of this in our daily life is people come into our office with a viral cold and they want an antibiotic, and you give them an antibiotic. Generally, viral colds get worse for the first 3 to 5 days and slowly better from there. Most people don't come the first day they get sick. They come 2 or 3 days into it and they're sick. they want their antibiotic, because when you get an antibiotic 3 days into your cold, turns out you get better over the next 7 to 10 days. When you
naturally, and you get better naturally, right?
Correct. If you give people Skittles, they get better over the next 7 to 10 days.
Correlation does not equal causation.
That's right. And
Yes.
so the issue with this is they really need to do double-blinded, randomized, controlled studies, which take time. And these studies, the issue with them is there is breakouts from these studies where something is so much better than placebo, because people are the researchers are watching the data while it actually happens. And if you see clinically significant data during the middle of the study, they'll break the study and give everyone the drug. But the study has to be started and controlled. And I think they're working on that. But I think when you ask the question, how is data being used and abused, it's both on the good side and on the negative side.
Right. Yeah, you don't want to get too excited too soon, but I'll give you one guess of which global health organization is actually conducting the double-blinded placebo-controlled trial called.
Who would be that?
I do not know who it would be, but it is called, and this is so ironic, Solidarity is the name of the trial. I kid you not. But
and who's doing it?
The WHO. WHO, the World Health Organization.
Correct.
Yes, and it is called Solidarity. And
we'll get into crisis communications at the end of this conversation, because I have a couple of questions about some misleading direction given recently by the White House in terms of which direction to go. So, by the way, Terry Bryant tuned in. Say hello, David and Beth.
Hello, Terry Bryant.
I hope you and Gail and the kids and everybody and grandkids are staying safe.
Drop a power seater by my house. No,
there you go.
Seriously, we don't need one.
We don't need one. Don't do that.
I think last time I got something from Terry, it was a power seater.
There you go. Okay, but Beth, on that point with Terry and Gail and others that are tuning in, so advice-wise, with all of these conflicting studies, and by the way, there are already enough studies that said coffee is good for you, coffee is bad for you.
Right.
How would you boil it down to a parent if they came in or someone that called you?
I would follow the CDC's advice. That's the job of the CDC. The CDC is not perfect. Things depend on funding. If you look at CDC or FDA or WHO, they depend on funding, but that's their job, is crisis communication. And they take all that, and they have very smart people who read it and distill it down for us people who maybe aren't as smart as some of the crazy smart people there, and give us guidance on what to do. So I would follow them. It's hard to really go wrong that way, but it is, I would just say, we spend a lot of time in medical school learning how to interpret studies. And I forget what the proportion of studies, like if you look at the abstract and you read the cover, which is kind of like a cover page of the study, how the data are inside the study are not really supported by the abstract. So this is the study out of Chicago. Right. You can't just read the summary. You can't just read the Cliff's Notes. You have to see how they got their data.
Right. Well, as I segue, I put Jenna's little shout out there. She says, hello, David.
Hey, Ms. Jenna.
So I'm gonna drop from the screen and put you all up, because I'm gonna go to another screen and see if I can pull up the latest heat map showing where the hot zones are in the country. Mm-hmm. What I'd like you to do for a minute or so is kind of deep dive into helping people understand what I am once again terming the two Americas. And this really is a situation where there are some places where this is absolutely life and death, and there are other places in the United States where they're just not feeling it the same way. So I'll toss it over to either one of you to kind of take that where you wish, and I'll be back in a second.
Okay.
So this is something that I've actually talked to Joseph about. Joseph in transportation has spent a lot of his, if he has an adult life, he's spent a lot of his adult life working in the transportation sector. I assume you can.
I'm actually still here. I didn't put it on mute. But go on.
But one of the things that you see is certainly he doesn't. I can't see the graphic that he's going to put up, but I have a suspicion what it's going to look like, which is number one, places with effective mass transit are affected by this, because if you live in New York City. I get in a car, I drive, 2 or 3 miles. It takes me like 5 minutes to get to work in the morning and back in the evening. in my car by myself. And, that's not a real threat as far as catching communicable diseases between here and Central Baptist. The issue is if you live in Queens or if you live, anywhere in the city, in New York City, unless you're close enough that you can walk or have enough money that you have a driver, most people are on the subway. And so all of us have been in the subways, New York, Washington, D.C., and, those places are very much affected by this because of the number of people in close quarters. And what's interesting is you look at that versus Los Angeles. It doesn't really have as well developed as a mass transit system that people are using. And you see this space. And so the darker areas, it turns as you look through here, all of which are large cities where there's increased urban density, mass transit.
I mean, isn't that pretty much in the Northeast, the Amtrak line? What you're looking at?
But I do want to caution, though, as you said, Beth, the difference between causation and
correlation.
I'm not saying, I don't mean to suggest that mass transit is causing COVID.
Right. I just wanted to spell that out.
Yeah, correct. That's not what I'm saying. But what I'm saying is when you are, 6 inches from somebody else for 20 or 30 minutes, breathing in and out their air, sharing air, you are at an increased risk of contracting this or tuberculosis or flu.
This would be the same reason, right? Logically, that healthcare workers get this at a higher rate.
Correct.
I'm exposed to it multiple times a day. And so is someone who rides the subway in New York. They just have more opportunities for exposure versus somebody who's a rancher in Montana, where your nearest neighbor is 10 miles from you. You're just not going to be within that 6-foot radius of somebody else to cough or sneeze on you.
For prolonged periods.
Yeah, for prolonged periods. And so that's why healthcare workers have a higher rate of acquiring this. And people who live in higher levels of population density are going to have more opportunities to acquire it. And that's why it doesn't seem like kids get it as much, but say they did, a child that was in homeschool would have less of an opportunity than somebody who was in a big public school. So it's the same thing.
And you see that because the numbers that I've seen are up towards 20% of people in ICUs in the country are healthcare workers.
Yeah.
Right.
So let me ask a similar related question, which goes to this notion of what does the end of this look like? And what you all have said consistently the last 2 Saturdays we've done this is that the answer is about testing to know who's either does have it or has the antibodies, meaning that they probably had it. Right. And then secondly is contact tracing to be able to know how to find all the people that they may have come in contact with so that he or she can be quarantined and then everyone else can go back to work. Has anything from that guidance from the last 3 weeks, in your opinion, changed?
No.
Okay. Still the same. Beth, you agree that's still the same consistent answer?
Yes. And I think, and you and I've talked about this. I've talked to some of my patients about this. Anyone who was in the Boy Scouts, anyone who was in the Girl Scouts, anyone who ever took a first aid class knows that if you roll upon somebody who's bleeding out of a hand or out of an arm, the best way to stop it is to take your belt off and put a tourniquet on. And the one thing we teach people about tourniquets is that once you put a tourniquet on, you should not take the tourniquet off. You take them, they need to get to a physician to deal with the wound before the tourniquet comes off.
You're only going to make it worse.
You're only going to make it worse. And
if somebody other than a medical professional takes it off.
That's right.
Okay, we're going to get to that at the end. So let's talk about Jim Young's got a question. How often should we retest when everyone goes back to work?
So the problem is we don't even know. This is the one thing I was going to say may have changed since next week. We don't really know if this is something. We're assuming this is like chickenpox, like you get it and then you don't get it again. Or it's like measles, you get it and then you're immune forever. This may not be like this. So other respiratory viruses like rhinovirus or RSV
or coronavirus
or the, like I call it in Kentucky, the hillbilly coronavirus. You get it. You're immune for a few months, a year, And then guess what? You're not immune anymore and you can get it again. I mean, as a pediatrician, I can't even tell you how many colds I've had. You all can only imagine, right? Like after 20 years, I would never, ever get a cold. If that were true for respiratory viruses, it's not. And so when Jim asks that, I think the question we need to answer before we answer how often should we retest is, are you really even immune? Right?
After having it.
Yeah, and we don't know that, which to me, that's a very scary unknown. It would be very reassuring if we knew you got it once and that was it. I'm afraid, based on what we know about other coronaviruses, that that's not true. But I hope I'm wrong.
So then let me move to, because we're already wrapping up, we're over well past halfway. So depending on where a person lives and depending on their density, as we talked about earlier, whether that means that they're taking mass transit or driving themselves to work, it usually just means, oh, that's a much better angle. Much better angle. Thank you, Dr. David Hawse.
We look at the battery. We're about to die. Yes.
Oh, well, that's good. You got to have the battery.
Prepared.
So regardless of where a person lives, if you do this notion of testing, either for the coronavirus, COVID-19 or antibodies. Mm-hmm. And then we implement some kind of a system of tracing. Right. What are you thinking about large mass gatherings, whether they be sports events, concert events, entertainment events, anytime in the near future? Because people are going to hear a lot from social media and or entertainment-owned news networks that have maybe a slightly different incentive than the medical industry. So what would you say?
What I would say is what any good doctor would tell you about anything that they can't be certain of is, I don't know. And the truth is I don't think anyone knows. I think we have so many things to learn about this virus before we get to the point of when are we going to put 60, 80,000 people in a football stadium right on top of each other, or, a couple of hundred people in an airplane right by each other. We're just not close to that yet. And I think we're going to have to find out more about the behavior of this virus before we know that. And I think part of that problem has been, in China where it started, and now you're seeing like in places like New York, you can imagine how it was in Italy. The medical professionals are not having time to run through this and research it because they're busy.
Yeah, they're still in reaction mode.
Yeah, they're still in, it's the triage of what needs to happen. That's going to be kind of the morning rounds, or the morning report, so to speak, in medical terms, of where we dissect this and figure out what happened and why did it happen. We're just not there yet.
But I do think you can, what is my personal judgment about what I'm going to be doing personally? And, I saw a tweet the other day or you had shared something that said, when they lift this, I'm going to let all my friends go out for 2 weeks and see what happens.
That on Facebook today. She's like, I'm just telling y'all, 5 o'clock. 5 o'clock. Our lights always go out at 5 o'clock. But she said, you know what? I'll just let y'all run around for 2 weeks and I'll see how it goes for y'all. And then I'll come out of my house.
Yeah. Well, and I think that's the thing. When I start looking at football games in the fall, we're going to have a few weeks out and some experience before I personally am going to football games.
I think this is going to be like 9/11 was for travel. We never went back, right? Like I still can't take a real shampoo bottle to the airport.
Right.
Dangerous.
0.4 ounces.
Yeah.
That's dangerous.
And when you get a new normal, right? Humans really adapt to new normals. I mean, it seems like so insane that I would have ever swabbed somebody's throat at work without a mask on, but literally like a month ago, I was doing that.
Yeah. I mean, we are talking about new normal. This is where I'm coming from. This is Texas, Austin, Texas. And football is king here. And they're trying to figure out how we get people back together again for Texas Longhorn football. And it's already being investigated. The idea of going out to the Circuit of the Americas Formula One racetrack, which can fit about 150,000 people in one spot, but only put about 30 or 40,000 people in it, with everybody sitting 3, 4, 5, 6 feet apart, multiple rows between them.
Right.
So that's what we mean by looking at a new normal until we have more data. So let's end it on, without naming names, without naming states, because we don't want this to turn political. But regardless of where you live, do you think that now is the time to congregate together in large groups necessarily and protest any particular kind of mass gathering outside in close proximity to other people?
No.
No. And no.
It's an easy answer. It's a very short answer. No.
No.
That was a softball. I just had to throw it to you.
Yeah. The thing is, I think from a country, we have gotten very assuming the worst in other people, assuming the worst in the other party, assuming the worst and assuming people's bad things about people's motivations. And I'm not naive. I mean, people have some bad motivations out there. But I think that when you assume someone else is starting from a bad motivation or from a bad place, that you're oftentimes underestimating them to your own detriment.
Yeah.
And I will tell you that physicians in particular, by the nature of what we do, aren't really into doing things from a bad place. I mean, by the nature of trying to help other people, that's who we are as culturally. And so I will tell you that the governors and the president are at least hearing, what physicians are having to say.
Right.
And I think that the more that you can hear from actual scientists and physicians,
Right.
I would be more likely to take that to the bank than what I'm hearing filtered through. And I will say, in the state of Kentucky, I know that there was discussions when we first went into this lockdown about, we are concerned if we do this too quickly, that on the other side of this, people will get quarantine fatigue and want to come out too quickly.
Yeah.
And so,
Yep. Well, you even said it last week, David, if you recall. David, that you were actually pleasantly surprised at how well Americans were adapting to the idea of shutting down their businesses temporarily, hopefully not permanently. So speak on that while I bring up the numbers between Kentucky and Tennessee.
I was gonna say, the other part of it is, I understand that people are economically hurting. I mean, and I also understand that we're pretty privileged. Our hurting is not other people's hurting. Yes. I understand that, but I understand, it's scary for people, and we deal within our practice. I'll tell people, everybody from people that own a horse farm and that people come in with a 10-carat diamond ring to people that are homeless. We deal with the spectrum, which is one of the things I love about my job. But people that don't deal with the spectrum of the public, I think sometimes don't realize how many people are hurting and how many people truly live paycheck to paycheck and not even. And so when we talk about people protesting, I understand from a scientific standpoint, that is not a good idea. I understand how people can be scared.
Yep.
And people need to feed their family. I understand. I mean, I can put myself in their shoes. I'm not saying I am in those shoes, but I can try to imagine.
You can certainly empathize.
If I couldn't feed my kids, how scary that would be for me. And I would be like, well, my immediate problem is I don't know where dinner's coming from. So I can understand that. And I think what David's saying, to speak to motivation of people, we assume it's a greed motivation and it may be a fear motivation.
Well, and that's where I think it's important to draw the distinction between what you said, because my heart goes out to, and I talk often in these Catalyst talks about the first line of, concern and worry should be those that are sick and the healthcare givers that are right there. The second, to your point, Beth, are the people that have lost their jobs. And then the third are those businesses trying to struggle together to keep their folks employed.
Right.
But what I think, without getting political in this, because I want to keep it based on data and metrics, but where I think the leadership comes in, and this is why I brought up this graphic of the difference between the number of cases diagnosed in Kentucky and nearby Tennessee, which I would argue from a demographic standpoint, from a cultural standpoint, are very similar states, separated by literally just a straight line, artificial border, that when you see 2.5 times the number of cases, something's going on there that is something more than just facts and data. And it's leadership, not driven by ideology per se, but just leadership. Do you want to speak to that as we wrap up?
I think Andy Beshear, again, I will tote Andy Beshear, not because he's a Democrat
That's the governor of
the
Kentucky.
governor of Kentucky, but because he really got people around him. And it's funny because he will get on, like yesterday, his 5 o'clock thing, he was up there with data. I mean, he's up there with data and graphs every day. And you can tell he's presented with data. He thinks through the data. He's not a scientist, but he gets people around him who can explain it to him, and he makes decisions based on data. And people have asked him, and I do believe him. He's like, at this point, I'm so far beyond politics. You know, I'm just worried about how many people we're going to lose if we don't do something.
And the other thing that he did yesterday is, you know, President Trump came out and talked about, you know, it's up to the governors and these are the metrics that they need. And, you know, as a Democratic governor, you know, he got that and he went out in in his press conference and said, okay, we are using the president's things. This is what it's going to require.
Right.
And, you know, he's you know, you're talking May, middle of May, early June.
And here's the other thing I found interesting is we talked about reading the cover letter of a study versus reading the actual study. So I think in those Trump press conferences, we kind of get the cover letter. You know, he gets up and reads it. But Bashir says, you know, they get hundreds of pages from the White House about what the plan actually is to open up, which they read and then had basically a PowerPoint with these are what these are.
Yeah.
So it is nice to have somebody who's actually reading through it. And I think there's some science. It was reassuring. There's some science on the federal level coming in there too.
Yep. Well, I would like to end on that reassuring note that there is goodness happening at all levels. The only thing that I would caution folks is to spend less time using cable news pundits to get their medical advice or their best advice, but instead use more experts, scientists, data, and all the different ways. So we're getting ready to sign off. But Mary Beth just came on. Mary Beth Jackson Cooper says a couple weeks ago, you speculated Father's Day. You were just referring to this. Beth, do you want to revisit that date?
I think the projection yesterday was June 8th for Kentucky. So you're pretty good.
I think, you know, the thing is, it's going to happen in stages. It's not going to be, they're not going to flip a light switch and everyone's going to be, you know, out at, you know, camps and, you know, 4th of July and all of that. It's, you know, it's going to be stages. And as I have said, I'm not going to be the first one out of my house. I mean, I'm going to continue to go to work, but, you know, we're probably not going to be in the grocery for a while because we have other ways to get our groceries. Why do it? And I think that's the thing that people need to think about is, you know, even when we get through this, we all make risk benefit decisions every day. You know, what's the risk of getting in your car and driving to the grocery and getting groceries and driving back home?
Yep.
And, you know, and this is going to be just another little thing in that risk profile, and people are going to have to add that in. So, you know, I think it's going to be I think early June is where you're talking about it being more opened up.
I think there's going to be a lot of people working from home for a while because I think what we've learned is there's a lot of us including us, who I thought had jobs that we could never work from home, who've done a lot of work from home. And maybe that's not a bad thing.
Yeah. Oh, no, there's and by the way, you all are Catalyst Talk interview number 40, if you can believe it. So in only a month, I managed to speak with 40. Well, I can't say different folks because you guys are 3-time repeat, but have over 40.
We're going for the 5-timers club.
What's that?
We're going to be the 5-timers
club.
Okay, we'll figure that out. And Mary Beth does want to get back to see her grandmother, so that's why she's very interested. But yes, so this is impacting all aspects of society, which is, again, a shameless plug for my book, Catalyst, which was written 2.5, 3 years ago on the notion of leadership and strategy in a changing world, and what more unfortunate circumstances that so much of this is played out on. But you all have been fantastic once again. I encourage anybody that has questions for David and Beth to follow up on this thread, whether you're seeing it on Facebook or YouTube, or when I put it over on LinkedIn to follow up. And to the both of you, I wish you safety, good health, wash your hands, stay at home. And do you have any Tito's still in the house?
Michael's been home for a while, so it's getting
Okay.
Yeah.
Okay.
But yeah.
Well, I've got more Tito's here in Texas. If you need me to ship
I
any.
want Tito's hand
know.
sanitizer. I want you to mail that from Texas.
And what part? You said Tito's.
I want the Tito's hand sanitizer.
Oh, okay. Well, I'll see if I can get you some.
Mhm.
All right.
You all take care. Thanks a
Thank
lot.
you. Be safe.
Bye. So once again, thanks for tuning in for the 40th Catalyst Talk. If there's a topic you want to hear more about, if there's a person you want to hear from, or a couple like David and Beth, reach out to me either on my website, josephkopser.com, in this thread here, or over on LinkedIn. This is the extrovert in me trying to get out and figure out a way to be able to help and be of some value. Again, the people we're thinking about first are those first-line healthcare providers and the sick that they are caring for. It's that second tier of people that have lost their jobs, that don't know necessarily how they're going to make ends meet. Our heart goes out to them. And then thirdly, for all those businesses, all those entrepreneurs, those people trying to keep their businesses together, seeing it through this, that's where I'm trying to come in to provide that understanding or expertise of how to innovate, how to pivot, and if nothing else, try to just keep a sense of humor going through this as best they can. I'm Joseph Kopser. Thanks for tuning in. I'll talk to you at the next Catalyst Talks.